Good evening, everybody. Hope everybody's well. Here we are again. It's Thursday. It's 7 o'clock, and my name's Nick Thompson, and they call me the Gut Doctor. Many thanks to our friends at Verm-X. This is a product we use a lot in the practice. You can see there's some product we have just here, and we like it. It's we could not put these shows on without some support from Verm-X, so we thank them very much. They're a good bunch. How are you? I hope everything's well, and I hope you're enjoying this fine evening. My friend Jeff Johnson, who I saw practice with 30 years ago as a young vet. He was just starting in his first year. I was about fourth year, maybe. I saw practice with him, and we have worked together, and he's a homeopath now and uses herbal medicine, and he's come to visit. He has cycled all the way from Wiveliscombe, and he's here this evening. So we're gonna put some organic lamb on the barbecue, and we're gonna have an amazing salad that Ellie has made. So really exciting to get these things up and running. This evening, everybody, we are going to be talking about how do we look after the older dog, the older patient with herbs. And there are three key herbs that we're going to be talking about tonight. They are the web herbs: Withania, Echinacea and Boswellia. Let's jump into those right now. I'll just see that Rosie's happy, and I'm going to, so I need to put me down in the corner, that, and then I'm going to go over like that, and Rosie says we're looking good so far, and if she says we're good on there, I love this picture. if you've got a shaggy dog, then for the summer I would suggest get them as short as you dare. And also what I would do is, if you've got horses, do a trace clip them up underneath, especially for the oldies, because if they get over hot in the summer, they're gonna suffer. And so, well, we don't need to, because we've got Whippet Italian Greyhounds, and so they've got very short hair anyway. But if you've got shaggy dogs, consider clipping them underneath on their, we would call it the ventrum, on the underside, so that they can contact either cool grass or cool floors within the house, and that can really help. It's not breed standard for most shaggy dogs, but they will thank you if they need that coolness. So there you go. The Gut Doctor today, we are going to be talking about herbs, and we're going to be talking about the older dog. These are the web herbs. That's the easy way to remember it. WEB, Withania, Echinacea, Boswellia. Let's jump into that right now. Some people have said, how do I find a herbal vet near me? And these wonderful people are, I'm a member of them, but that's beside the point. British Association of Veterinary Herbalists, if you go to their website, have a Google, you'll find them, and they are the place to find a herbal vet near you. Okay. They will, you see there, the third button along Find a Vet. So there will be a vet within driving distance, and they are worth their weight in gold, and that's them, the British Association of Veterinary Herbalists. WEB, let's start with Withania somnifera. Somnifera because it's a calming herb. It's been known in the Ayurvedic tradition for thousands of years as being two things. One, it is strengthening. That's why they call it ashwagandha, strength of a horse. But it's also calming. It belongs to a group, a wonderful group of herbs called the adaptogens. I'm going to tell you about those in 1 second. Belongs to the adaptogens, but it is the only adaptogen that strengthens and fortifies and vitalizes, but also calms. So this is wonderful for use in many situations. We'll talk about that, but it's wonderful for the older older animal, especially if there's an anxiety element to it, because you are maintaining strength. And if they have anxiety, I don't know, they've got sore joints or maybe a degree of cognitive dysfunction, then Withania really is worth its weight in gold. Strength of the horse. So let's just talk about the adaptogens, because they're a fascinating group. As a group, they are to do with helping with stress, helping with fatigue, fight against fatigue. They're all about strengthening the individual. If we look at that from a biochemical point of view, they will help with increasing secretion. They will upregulate normal levels of glucocorticoids. These are the normal healthy steroids within the body that helps you have an anti-inflammatory response after an injury and helps to prevent the immune system from overreacting. An appropriate immune response is absolutely vital whenever you have an infection. But if you get an overzealous immune response, you start tipping into autoimmunity. And this is all too commonly seen in people, in dogs, in all veterinary species, more and more these days. But what we find is that the closer the animal is to humans, so mainly dogs and cats, we're seeing more and more in autoimmune disease, as we are in our children, in our adults. So Withania is a herb for the moment. It really is very, very useful. It's a stress herb, and helps with immunosuppression. There are very many situations in the modern world where immunosuppression is present, maybe because steroids are being used, or because post-viral immunosuppression or post-vaccine immunosuppression. So Withania is a remedy to study and to know very well, because it will be able to be used in so many different ways. The first time I came across the adaptogens as a species, my mother was very keen on nutrition and herbs and what have you when I was a kid, and it was known that the cosmonauts, because they to save money, I think, God bless them, the Apollo missions were days long, but the Soyuz missions were months long, because it took so much time and money to get these cosmonauts into space. So they kept them there for a long time and did lots of tests and experiments and what have you. And in order to help them cope with the stress of being in space for so long, and weightlessness, and being, the mental stress of being alert and away from family and what have you, it's a very draining environment. And so what they did is they gave them ginseng, and this introduced the world to the beauty and the strength of the adaptogens. They only knew about one then, but since then we have added other adaptogens like gotu kola. This is a very mild adaptogen, so if you need just a little bit of help, a little bit of a tonic, then gotu kola is a wonderful thing. If you need a very strong stimulus, and you have to be careful, for example, with fever, because the Panax ginseng, when given with fever, can strengthen the fever. Okay, so again, talk to your homeopathic vet, your herbal vet. Talk to somebody who knows about herbs before you start using the stronger end. Withania really is quite a safe herb to use. I'm going to give you a dose shortly so that you can use it yourself. And as I say, we've got this wonderful dichotomy. We've got strengthening and calming at the same time, and this is the hallmark of ashwagandha, Withania, somnifera. Slight antispasmodic effect as well. The main reason we would use it with our older patients would be to help with stress and anxiety. If there's anxiety for whatever reason, cognitive degeneration, for example. Also, it's so clever. We've got cardiovascular circulatory support there. All the adaptogens are anti-inflammatory, and Withania is no different. It's for use in all ages as well, for this rejuvenating convalescent effect. So if there's any situation where you think, we just need something to help give a boost, but say after surgery, some really massive orthopedic surgery or something where you say, right, we want great immunity, good gut function, but we need to help to not overstimulate the patient, then ashwagandha should be at the front of your mind. If you're trying to build up, again, post-surgery, increasing muscle mass and strength is just wonderful. In practice, in veterinary practice, we will use it against aspergillosis. This is a fungal infection, yeast infection that you typically get in the pharynx and in the sinuses. It's really quite nasty, and they have to use some very strong medicines. Withania can be used if you catch things early, maybe even on its own, but definitely in combination with some of the stronger pharmaceuticals. Helps with lab animal stress. Osteoarthritis is a absolute given. When you get older, you're going to get osteoarthritis, so that's great. As you get older, you may even have cognitive dysfunction. It seems to be becoming more and more of a feature within the veterinary world, and so Withania is really there. At any age, the use of prednisolone is a glucocorticoid. We can use it there, but also if you've got a dog with hypothyroid disease, then we need to think about Withania as just working in the background to help with thyroid function. There's a wonderful book by Dr. Jean Dodds. We've discussed it on The Gut Doctor before, and she's written a wonderful book called The Canine Thyroid Epidemic, which if you've got a dog who's got hypothyroid, that's low thyroid, hypothyroidism, or you've got a dog who you suspect might be hypothyroid, that's a wonderful book to jump into. Helps with anemia, cancer support, and geriatric support. I've put the dose here for you. This recording, this video will be recorded, and so you can come back to this talk so that you can see it again, and you can grab this. So you don't need to be writing it down if you don't want to. It's between 50 and 125 milligrams per kilogram. So if you've got a 10 kilogram dog, that would be 50. For the minimum dose would be 50 times 10, which would be 500 milligrams divided through the day, 2 or 3 times divided through the day. So that's quite an easy dosing. Let me just talk to you about other adaptogens, because it's one of my favorite groups. Romania is a wonderful adaptogen that we use. It's gentle enough to use on children, and so if you've got somebody post-viral or struggling with immunity or rehabilitation after any illness or operation, Romania is a wonderful herb to bring along. We've talked about gotu kola. In the Chinese traditional medicine tradition, they call it the spring of life. You can take it over long periods because it's so gentle, and it can really put a spring in your step. Bacopa is the Brahmin herb. It comes from the Indian tradition, and it helps with mental faculty and focus and concentration. So this is the adaptogen we would think about when we are coming up to our exams. So we've got licorice. I use a bit of licorice with most of my formulae. Helps to bring things together. It's got a lot of saponins just from a physical point of view, but it is very gently adaptogenic. Astragalus, I always think of astragalus is when you're struggling, you need astragalus. It's a strengthening, very much a strengthening adaptogen. And Schisandra, the 5 flavor herb, I use it for kidney disease and for liver disease, as well as for adaptogenic, immune and stress modulation. So the adaptogens, treat yourself to do some Googling on adaptogen herbs. They really are so useful. Everybody knows Echinacea, but everybody doesn't know Echinacea. I'm just going to give you a little rundown. There are two main types, purpurea and angustifolia, and laboratory studies show that it's not just old wives' tales that, oh, Echinacea is good for you, because it's been used for hundreds and hundreds and thousands of years. It shows that it boosts natural killer cells in Petri dishes. It amazingly, there are some studies which show that because immune dysregulation can promote aging, if you can improve immune function, you can reduce that immune aging effect, which is glorious. So let's all check out Echinacea in a really big way, and it's one of the few herbs that you can dose long term. So don't be scared about dosing this long term. I think as a rule, I would not dose any herb more than if it's in clinical prescription quantities. I wouldn't be prescribing for more than about 12 weeks. Okay, you need a break and then you can start again with most herbs. Echinacea, you don't need to be quite as careful because it's so safe. A wide range of dosing, down from 25 to 300 milligrams per kilogram per day. So if you've got a 10-kilo dog, you're looking at about 250 milligrams, a quarter of a gram, 3 times a day as dried herb. So it's very easy to use. You only need a smidge to use, and wonderful to use. 1,001 uses. As you see, it's all about immunity, because it helps with infection. You could summarize all of the entries on this slide as being, if there's infection, think about Echinacea. Most people think about Echinacea when they've got a cold, when they've got upper respiratory issues, and that's absolutely right. Wonderful to use that, but also really any infection anywhere in the body, anything that's not clearing up, then think about Echinacea. There's good science behind this. This is a 2003 paper, and just to summarize, the paper summarizes and says, these data suggest that Echinacea preparation can be recommended as a well-tolerated alternative treatment of canine upper respiratory tract infections. So they actually went the extra mile, these researchers, and actually did some research into canine medicine, which is great, because most of the research into Echinacea is in humans. I think that there is a massive parallel between herbs that are good for use in humans and herbs that are good for use in dogs, but it's not absolute. So this is why, talk to your herbal vet if at all possible. Other uses, just out of interest, you'll be able to come back to this again. Lots of infection, boils, gum disease, abscesses, and what have you. But some of the really interesting ones would be chronic fatigue syndrome. It can help to balance, to harmonize the immune system. Also migraines, many causes of migraines, and it's usually not to do with infection, but it's very useful there. Acid indigestion, so reflux, could benefit from the use of Echinacea. And dizziness, I can honestly say I don't know how Echinacea, if it was immune mediated, I would say autoimmune neuropathic effects, then I can imagine that, but most dizziness is not, dizziness, vertigo. So There you go. Very interesting, very powerful, broad-reaching herb with so much use in the veterinary context. Okay, one of my favourites, Boswellia, and the what can we say about Boswellia? Boswellia is frankincense. Frankincense, as in gold, frankincense, and myrrh. Here I found a lovely picture of the three kings. They brought, according to historical and religious texts, they say they brought gold, frankincense, and myrrh to the Christ child. Gold because he was to be the king, frankincense to venerate him as a god, as a deity, I guess. Religious studies is not my forte. But also frankincense. Why did they bring frankincense? An anti-inflammatory, a balm, a soother, a healer, because it supposedly presages the crucifixion, which is slightly spooky and slightly beautiful at the same time. But that's perhaps somewhat a way to think about Boswellia, is that it's frankincense and it was brought to the child all those years ago. Back to the present day, back to science. Boswellia resin contains boswellic acid, along with many other. Most herbs contain 400 to 600 different chemical compounds, which is why they're so versatile. They're so resilient to microbial or resistance from bacteria and viruses and what have you. And we know from studies in the laboratory that boswellic acids, if they are isolated, they have a strong anti-inflammatory action, which is in some cases similar and comparable to using a non-steroidal anti-inflammatory like Galliprant, like Previcox. I'm not going to mention the M word because I don't like that one. Or like say paracetamol. Paracetamol is having a resurgence of use in veterinary medicine these days, which I think is fantastic because it's really cheap and easy to use. Obviously, you've got to use it with care and under the supervision of your veterinary surgeon, but I'm glad to see it. We were not taught to use paracetamol when I was at college, so that's quite nice to see. Another study has told us that Boswellia inhibits pro-inflammatory mediators in the body, such as leukotrienes, which is all very, sciencey, but it inhibits pro-inflammatory. Therefore, we have this known anti-inflammatory effect. The dose is very broad. That's a typo. It should be 25 to 500. Apologies, 25. But if you give 2, that's fine. It's just you won't get much effect. 25 to 500. Again, you see we've got a very broad range of dosing. So it's always with herbs, we'd start at about the low end of the dosing range, ideally in conjunction with our herbal vet, and we would dose to effect, not dosing chronically at high doses for month after month, year after year. This is the Boswellia serrata, the tree SERRATA because the leaves are serrated, and this is the amazing gum. This is this is why when you take Boswellia, it tastes like floor polish. You remember from primary school, my primary school, they used to use kind of resiny polish on the floors, and so whenever I smell Boswellia, it takes me back to primary school. Or if you played the violin, rosin for the bow, yeah, it's similar to the resin, the Boswellia serrata. Beautiful, great. Out in the desert, classically, we get a lot from Morocco and Algeria and these kind of beautiful desert countries. Anti-inflammatory is the key. So that's bursitis, tendinitis, osteoarthritis. Yeah, osteoarthritis is guaranteed if you're lucky enough to get old enough to develop those degenerative joint diseases. And so wonderful. Even if it's not a kind of degenerative arthritis, if in humans you've got rheumatoid, which is an autoimmune arthritis, Boswellia can be very, very useful. So our minds immediately jump to joints when we think of Boswellia, but don't just leave it there. Also think of the gut. If we have cases of IBD, and in humans Crohn's disease, or in humans ulcerative colitis, we have this strong anti-inflammatory effect. But it doesn't even stop there. Think of the respiratory system: asthma, hay fever, sore throats. Wonderful. If you need, I think of Boswellia as my herbal non-steroidal anti-inflammatory, and if we combine it with Echinacea, and maybe even combine it with Echinacea and Withania, which I think is probably a great idea, then I think we've got a powerful trio there. Brain injury, syphilis, don't see a lot of that about these days, and definitely don't see it in my patients, but it's recognized. The studies have been done. Painful bleeding, diabetes, cancer support, increasing urine flow, increasing flow. So this is marvelous. There, this is why these three herbs are so powerful, because they're gentle, but they work at a very powerful, deep level, and combining them is a great idea. Just don't use them for months and months on end. One prescription that one could do is a week on and a week off, and a week on and a week off. I think that's okay. Or maybe a month on, a month off. That might be a little bit of a long time without. So maybe a week on, week off is a good way to do it. I've used that before very successfully with these three. Just out of interest, while we're talking about pain herbs, because they're fascinating and so useful, white willow, salix, as in salicylate, as in aspirin. This is where they got the salicylates from initially. Ginger is a wonderful, best used in winter because it's very warming, best to avoid. It's not life and death in summer, but to avoid in summer. Turmeric is very trendy these days. It's a very powerful pain herb, and it's also anti-cancer. It's great for gut health. Devil's claw, everybody knows about devil's claw. It really is very safe. Again, we're not using long term. Surprisingly, nettle is anti-inflammatory and is an anti-pain. Maybe it's not a surprise, because nettle, we all know if you mess with nettle, you're going to get pain. So maybe that's perhaps the way to remember that Urtica dioica is a pain herb. And one of my favorites, Menanthes, is the bog bean, which is one of the few, apart from white willow, is one of the few UK derived pain herbs. It's very old fashioned. It's difficult to get hold of, actually, but just out of interest, I think this is fascinating stuff. So guys, that's us. Well, let's do a few questions before I go down and have some dinner with Jeff and Ellie. We have spoken about the wonderful dichotomy which is Withania, the strength and the calming of Withania. I've introduced you once again to the adaptogens. They are fascinating. Please, if you're interested, get to know the adaptogens. They really are wonderful. Echinacea, the herb that you thought you knew something about, but actually there's a whole world of therapeutics there that we can take advantage of in this world of autoimmunity we find ourselves in. And also we see plenty of infection in our patients, in our young and our old patients. And the wonderful Boswellia, nature's anti-inflammatory. Yes, it's for joints. Yes, it's for gut, but it's for many, many, many other things. So guys, that's us. Let's come back to you, and we'll bring me back up here. Let's hide that one, and that brings me back. And so Jane is there, Tina Lane is there. That's great. Hi Lillian. Phil Townsend is with us as well. I'm just picking these at random, guys, but Phil, it's great to see you there. We have a 4-year-old Rottie with ED-OA. ED, not sure what ED is. OA, I presume, is osteoarthritis. What would you recommend as a starting dose? I would start small. The dose we've just mentioned, 25 to 50 milligrams per kilo per day, divided into twice daily is the easiest. You can put them in food. And I would be thinking, if you've got osteoarthritis, you could use all three, W, E, and B. The one to concentrate on, though, for me would be Boswellia. Okay. Okay, let's have a look. Rach Mack is here. Hiya, Rachel. Okay, let's have a look. Let's have a look. What does she say? This is Friends and Canines Dog Trust. Ooh, I have chronic tiredness from COVID. Why have I not thought of these? I mean, upping my iron. Fantastic. Yes, WEB would be very appropriate. Maybe not so much the B, unless you've got, achy joints and what have you. If you've got post-viral problems, then WEB is lovely, really great. Eileen Davis is here. Great to see you, Eileen. And she said, yeah, yours love licorice. That's great. Don't go too much for too long and you'll be in great shape. And okay, let's have a look. Okay, let's have a look. What's Banjo saying? Here we go. Banjo is saying, we'll do one more after this. Can you use Withania for stress? Yes, you can. It's if I was looking at stress herbs, I would be going more the for immediate effect. I would be looking at maybe the passifloras, the skullcaps, valerians of this world. You get they're more first line stress herbs. The Withania is more of a slow build, so I would go with those if I were you, Banjo. Okay. So that's a nice question. The final question, here we go. Are they safe with antacids? These three, let me think. Withania, yes. Echinacea, yes. And Boswellia, yes. Again, Trish, Boswellia might be your friend indeed, because it's a very good anti-inflammatory. So if you've got gastric, duodenal, ileal, jejunal inflammation, in fact, even colitis, then Boswellia is wonderful. So yeah, I would get into thinking about Boswellia as an anti-inflammatory effect in those situations. Talk to your vet, just as you wouldn't give penicillin willy-nilly to the dog, or you wouldn't give Galliprant willy-nilly to the dog. Herbs are powerful. You can't muck about with them. So take advice, and that would be a great thing. There we go. So, guys, lovely evening. It's been really good. This is my new office, by the way. We've moved the office. I'm working from home now. It's wonderful. Ellie works here behind me. She's taken over from Lynn. Things are going really swimmingly, and we're having a great time. And it means I can take the dogs for a walk every morning and every evening, which is really wonderful. Looks like we may have frozen. Why does it always freeze at the end? I don't know. If you can hear me, great. If not, I'm going to say a very, very good evening to you, and I hope you're well. And we are going to see you in 5 weeks. We're going to see you in 5 weeks. I think we have frozen, but we're going to see you in 5 weeks. Thank you so much, and look forward to sharing some more thoughts with you in 5 weeks' time.